And away from politics, she came into contact with a patient who later tested positive for coronavirus at the Bolgatanga Regional Hospital back in March this year. After exhibiting symptoms of the disease days after, the head of the neonatal intensive care unit of the hospital, Dr. Gillian Bogi, had to be airlifted to the Korle Bu Teaching Hospital for critical care. 20 days after hospitalization, she has now tested negative twice and subsequently discharged. Dr. Bogi has been sharing her near-death experience exclusively with Komladom.
The publication of the new recovered numbers attracted comments from some persons who were surprised about the high recovery numbers of over 500. A special aide to former President John Mahama, Joyce Bawa Mokhtari, called for the numbers to be put to strict proof. Minority Member of Parliament for Tamale North, Alhassan Suhini, said the recoveries are a Ramadan miracle. But speaking on Beyond the Lockdown, Deputy Minister of Health, Dr. Bernard Okuboy, stated the patients did not recover in one day.
So, if you have 1,000 folks, they are all walking around. They've had their first test, which is negative. All they are doing is that we are waiting to be tagged. Not that they have a problem, but they want to fit a criteria, which is that the second test must be negative. And so, really, you can have 2,000 who are declared recovered. All it means is that their results went through Noguchi or the other labs, and the results are in. So it is not the day they declared the results that they were recovered, they actually recovered, but they were just meeting a criteria.
An article by fact-checking website AFP challenged claims that Ghana has administered more COVID-19 tests than any other country in Africa. According to AFP, available statistics they found indicate Ghana comes behind South Africa and at least 2 other African countries. Dr. Okuboy stated Ghana is part of the top.
Well, we are gone greatly into that story, and that story is about numbers of recoveries and then related issues of tests that had been done, you know, in Africa, especially based on comments by the president about how far the country has done in relation to other countries on the continent, and this had been corrected, or perhaps also put out there by AFP, a French news agency. Well, we will now have to bring our story about Dr. Bogi, who has now been declared negative and recovered from coronavirus, and sharing her experience with Komladom.
I felt I couldn't breathe very well, especially when I had coughed for a very long time. I felt I couldn't breathe very well. So I decided to check my SpO2, and it was ranging between 65 to 70% of oxygen. So initially they nebulized me, and then I was put on intranasal oxygen. The ambulance came, took me to the airstrip, and then I was airlifted to Tamale, where another flight was ready with the team waiting for me. And then I was brought to Kotoka, where there was another ambulance waiting for me. And I was brought to the medical ICU, Korle Bu Teaching Hospital.
Wow. Do you remember anything that happened to you when you got to the ICU, medical ICU at Korle Bu?
Yes, I do remember. One thing I didn't tell you was when I started desaturating, I started writing down messages from my family. I started videoing myself, because at a point in time I gave up. I knew that I have the COVID, but it was like nobody believed I had the COVID, and anything could happen at any time. So I started writing messages, and I started videoing myself, what I was going through, and then in my diary.
If you say anything could happen, you thought you were going to die?
Yes, I actually thought I was going to die. Yeah, that was what was running through. So I would just sit down and then ask myself, so what next? Then I would just say, Lord, may your will be done. That was just what was running through my head. And then they kept on monitoring. So they would come in at 6, they would come in at 10 a.m., 6 a.m., 10 a.m., 2 p.m., 6 p.m., and then 10 p.m. in all, I managed to get all the staffs that attended to me. 33 staffs attended to me in the medical ICU. 33, including nurses and then doctors, 33 staffs. So as I lay in there and I started thinking, okay, so what next? All this while my husband would call to see how I was doing. So when I told him my test results was in and I was actually positive for COVID, he was like, do you know something? Are you still on oxygen? I said, no, the oxygen has been taken. He said, yes, that's just it. You would make it, you would pull through. God was in control and everything was going to be okay. And from the way he spoke, I could feel, I know him, I could feel he was crying, but he never, I would always see him on video when he's talking. But this particular day, he was hiding his face and then his voice was a bit shaky.
He didn't want you to see that.
Yes, but he kept on encouraging me and telling me that everything was going to be okay, everything was going to be fine. Yeah, so I spent 8 days in the medical ICU, and then later on, I was moved to fevers unit where I spent 12 days. Then the most interesting thing I experienced during my recovery was the fact that most of the mothers whose kids passed through the newborn care unit, I don't know one way or the other.
How they got to know?
They got to know that Dr. Boogie was not around and was sick and was actually having this condition. So they would call, they would call, they would call. When I don't pick, they would send me messages, and some of them went a step further by recording some of the babies trying to crawl, especially the preterm babies who went through kangaroo and were making it now, trying